The skills demonstrated in this program include adding medications to IV fluid containers, administering IV piggyback medications, administering IV medications by mini-infusion pump, and administering medications by IV bolus. Remember, as you administer IV therapy, you need to apply infection control measures, adhere to the 5 rights of medication administration, assess your patient for any known drug allergies, plan individualized care to anticipate and prevent complications, provide patient education, reinforcing explanations of the rationale for therapy and how the patient can avoid disrupting the IV. Apply critical thinking in decision-making and evaluation of the effectiveness of nursing care. Also, remember that care and compassion for the patient's experience are equally important as the patient copes with the discomfort and reduced mobility of intravenous therapy. The skills of administering intravenous medications cannot be delegated to assistive personnel. However, because assistive personnel work closely with patients during their routine care, it is essential for staff to know what to report when problems arise. Instruct staff to inform you when a patient complains of pain at the IV site, there is apparent leakage of fluid from the IV, or the IV infusion alarm sounds. What is the physician's order for type and dose of medication? What type of equipment is required for administering this medication? How should medication be prepared? And what is the prescribed administration rate for the IV fluid? Always wash your hands first. Check the order with the label of the medication to be sure you are administering the right drug. Be sure you have the correct supplies. You will need an alcohol swab, the medication from a vial or ampule, a medication label, a syringe of appropriate size, 1 to 20 milliliters, and if a needleless device is not used, a sterile needle, 1 to 1 1/2 inch, 19 to 21 gauge with special filters if needed. If a filter needle is used, replace it with a regular needle before injecting the medication into the IV fluid container. Check the prepared medication with the patient's order one more time. Check Mrs. Clay's identification bracelet and ask her to say her name to confirm that you are administering the medication to the correct person.
Can you tell me your name, ma'am?
It's Raquel Clay.
Great.
Explain how the medication is to be given and that no discomfort should be felt when the medication enters the venous circulation. But also encourage Mrs. Clay to report any symptoms of discomfort, including problems at the IV site. Assess the infusion site. Be certain the needle or catheter is patent and positioned in the vein.
We just want to check your IV here and make sure that it's running fine before we give you this medicine. This is going to be just a little tight.
Use the tourniquet test. While the existing IV is still infusing, place a tourniquet gently on the patient's arm well above the IV site. Observe the gravity drip of the fluid. If the IV is infusing properly, the tourniquet will cause the drip rate to slow. If the IV is infiltrated, the tourniquet will not affect the IV rate. Act quickly and keep the tourniquet on only a brief time.
No pain?
Also check the IV site for signs of plebitis. Close the clamp on the IV line to prevent medication from entering the tubing before it has been mixed with the IV fluid. Locate the medication injection port on the plastic IV solution bag. The medication port has a small, self-sealing rubber stopper. Be careful not to use the port for IV tubing insertion or the air vent. Use an antiseptic swab to cleanse the port, being careful not to touch the port with your fingertip. Remove the needle cap or sheath from the syringe and insert the needle or needleless adapter through the center of the injection port. Inject the medication. Then withdraw the syringe. Activate the safety shield. To mix the medication and IV solution, hold the bag or bottle and turn it gently end to end. Rehang the IV bag on the IV pole. Then reestablish the infusion rate. Complete the medication label with the name and dose of the medication, the date and time, and your initials. Apply the label to the bottle or bag. Because this patient has a new IV bag, a flow strip is needed to track the infusion over time. Only mark on the flow strip, not directly on the plastic IV fluid bag. Dispose of your supplies. Especially sheath needles are discarded as a unit with the needle covered. Document in the medication administration record the medication name and dose, the time the medication was added to the IV fluid container, the volume of fluid in the fluid container, the patient's response to medication, and the integrity of the infusion site. Perform follow-up assessments every 1 to 2 hours or as directed by agency policy. Another method of administering IV medications is the piggyback infusion. It is used to administer medications intermittently. The term piggyback is used because the small bag or bottle is set higher than the primary infusion bag or bottle. While the piggyback infusion is flowing through the tubing, the primary infusion stops, then resumes flow when the piggyback infusion is finished. The piggyback method reduces the risks associated with rapid drug dose infusion. Use the following questions to help plan your intervention. Are IV and piggyback fluids compatible? Is the IV site intact and without complications? What is the prescribed infusion rate? And what equipment is needed for a piggyback setup? Your supplies for assembling a piggyback system include the following: medication prepared in a labeled infusion bag, a short microdrip or macrodrip infusion tubing set for the piggyback, an antiseptic swab, and a medication administration record or computer printout.
I'm Sharita, and I've brought your IV antibiotics that the doctor has ordered. Can I look at your name badge, please?
Check the patient's identification band and ask the patient to state her name.
Can you tell me your name?
Raquel Clay.
Okay.
Check the patient's order and be sure the correct drug has been prepared for piggyback administration. Assess the infusion site to be certain it is intact and without complications. Use aseptic technique to open supplies and to connect the piggyback tubing to the medication bag. Open the regulator flow clamp to allow solution to fill the tubing. Then recover the end of the tubing. Hang the piggyback medication bag above the level of the primary fluid bag. You may use a hook to lower the main bag. Then connect the piggyback tubing to the appropriate connector on the primary infusion line. Regulate the flow rate of the piggyback solution by adjusting the regulator clamp or IV pump infusion rate. The rate of flow should be determined by agency policy or by consulting the pharmacist or drug manual.
This antibiotic might cause some burning, so as it's infusing, if you experience any discomfort or anything, please let me know, and I'll check periodically.
During infusion of the medication, assess your patient's response. If the patient complains of burning or stinging during infusion, reassess the IV site for signs of chemical phlebitis. If there is no pain on palpation and no obvious reddening around the vein, slow the infusion and adjust the rate to infuse over the maximum time allowed. After the medication has infused, check the flow regulator on the primary infusion, which should automatically begin to flow when the piggyback solution bag has emptied. When necessary, adjust the primary infusion line to the desired rate. Leave the IV piggyback bag and tubing in place for future drug administration, or discard used supplies in the appropriate containers. After the medication has infused safely, document the procedure and the patient's response. Include the medication name and dose, the medication volume, the time the piggyback infusion was started, the infusion rate, and the patient's response. The Mini-infusion pump is a battery-operated device that allows medications to be given in very small amounts of fluid, usually 5 to 60 milliliters, within a controlled infusion time using a standard syringe. Use the following questions to assist in planning your intervention. What medication is prescribed? Are IV fluids and medication compatible? What is the prescribed infusion rate? And what equipment is required? Supplies you need to administer IV medication through an infusion pump include the following: medication prepared in a labeled syringe, a mini-infusion pump, infusion tubing for mini-infuser with a needleless blunt cannula or needle, antiseptic swab, and a medication administration record or a computer printout.
Hello, Mr. Klein. My name's Richard. I'm a nurse
Always
here.
wash your hands before you begin. Also, check Mr. Klein's identification bracelet and ask him his name to ensure correct identification.
Just want to make sure we get the right guy and the right medication. Very good. The doctors have written for a medication that should help you with your breathing. It's called Lasix. And
connect the pre-filled syringe to the mini-infusion tubing.
Fluid off of your lung. Okay.
Carefully apply pressure to the syringe plunger, allowing the tubing to fill with medication. Place the syringe into the mini-infusion pump and be sure the syringe is secure. Hang the infusion pump on the IV pole.
Has this IV been bothering you?
No.
Assess the IV site for signs of phlebitis or infiltration.
Take a look at it.
Connect the mini-infusion tubing to the main IV line. Shown in this example is the technique for a needleless system. Press the button on the pump to the on position or set the pump to deliver the medication within the time recommended by agency policy, the pharmacist, or drug manual. When the infusion complete alarm is available, make sure it is in the on position.
Mr. Klein,
Yes.
how we doing?
Well, I'm feeling about the same. I'm ready to go to the restroom.
After the medication has infused, turn off the pump.
Let me just get you unhooked here.
The primary infusion should automatically begin to flow once the pump stops. Assess your patient's response to medications and document the procedure in the medication administration record, an intake and output flow sheet. An intravenous or IV bolus is the introduction of a concentrated dose of medication directly into the systemic circulation. Also referred to as IV push, the technique may be performed by direct injection into a vein, an existing IV line through an injection port, or a saline or heparin lock. Use the following questions to help in your planning. What is the physician's order for type of medication and dose? What is the correct rate of IV injection? What are the characteristic actions of the prescribed drug? Is the drug compatible with existing IV fluids and additives? And are there any signs or symptoms of problems at the IV site? You are preparing to administer Mrs. West's pain medication by IV bolus.
How are you feeling?
Supplies you will need include the following:
Okay.
a watch with a second hand, a medication administration record or computer printout, disposable gloves, the medication prepared in an appropriate size syringe and 2 3-milliliter syringes with 2 milliliters of normal saline to flush the saline lock prior to and after injecting the medication solution. Because the IV bolus allows no time to correct errors, you must be very careful in calculating the correct dose, and you may be required to have your calculations verified by another nurse. Wash your hands. After preparing the medication and checking it against the order, next check Mrs. West's ID bracelet and ask her to state her name to confirm correct
And can you
identification.
state your first and last name for me?
Melissa West.
Okay.
Explain the procedure and assess the site for visible signs of phlebitis. Remember, Some medications may cause a stinging or burning at the venipuncture site. Encourage Mrs. West to report any discomfort at the IV
I'm going to
site.
go ahead and give you the medication now to help your pain, all right?
Apply disposable gloves. Clean the saline lock injection port with an antiseptic swab.
This is just some flush.
Then insert the syringe with 2 milliliters of normal saline through the injection port of the saline lock.
Burning or stinging, all right?
Flush gently with normal saline while assessing for infiltration and resistance.
Does that feel comfortable?
Ask the patient again if she feels any discomfort. Checking for a blood return may be standard procedure at your agency when using a saline or heparin lock to confirm needle placement within the vein. An absence of blood return may not indicate the IV catheter is no longer in place. Use your critical thinking skills. If resistance is felt, stop and evaluate the cause. Never continue to apply force. It may be necessary to discontinue the IV site and start a new one. Remove the saline syringe and clean the injection port with an antiseptic swab. Insert the syringe containing the prepared medication through the injection port of the saline lock. Inject the medication slowly. Use your watch to time the injection according to agency guidelines or recommendations from the pharmacy or medication manual. Another option is to administer an IV push medication through an existing IV line. In this case, it is unnecessary to flush the line first. Simply insert the syringe of medication through the port closest to the IV site. Pinch the tubing, then inject the medication slowly. Withdraw the syringe when medication has been injected.
Now, once again, I'm going to give you the flush to make sure that the medication's all in.
Then clean the injection port with an antiseptic swab and flush the well and catheter with 2 milliliters of saline from the second syringe. Use the same rate for the flush as for the injection to ensure that any medication remaining in the needle is delivered at the correct rate. Observe the IV site during injection for sun swelling. Also assess your patient for several minutes for any stinging at the site and adverse effects from the medication after the injection. Place uncapped needles and syringes in a puncture-proof and leak-proof container. Discard your gloves and wash your hands when you are finished, and document the procedure in the medication administration record.